If you have low back pain and you do this 6-step mobility routine with me, you will improve your mobility and strength of your low back and hips. And I can promise these unique movements that you haven't done before will leave you feeling less pain with better movement than you felt in a long time. My name is Dr. Grant Elliott, and we've helped thousands with low back pain, disc herniations, and sciatica fully recover through our one-on-one online coaching program. And in this episode, I'm going to walk you through a routine to finally unlock your mobility and pain. Now first, let's go over why this routine is so effective. Low back pain is the #1 disability in the world, costing healthcare over $100 billion a year. It's not managed well. And like so many of you, it wakes you up in the morning. It's a beautiful introduction to your day. And the longer you sit, the more you feel it. Driving in the car for long periods, or just simply bending over to pick up your phone off the ground. You feel like it's gonna go out. You're walking on eggshells, and you're tired of not being able to move the way you want. What healthcare doesn't tell you is that you can resolve this super easily when you find the right movements. But what healthcare does tell you is, hey, stop moving, take these pills, get an injection. We need an MRI to see what the problem is. And then they push you to invasive procedures, and they talk like surgery is the only thing that's going to be able to help you. And that's because healthcare thinks you're dumb. They think you're lazy. They think you don't care about finding the right information. They think you just want to lay back and have someone else do the work for you. But obviously you're watching this video and you follow me because you're looking for something different. You're looking for exercises and movements to take charge of your health and actually get results that'll last. So what this means is that low back pain is largely a movement-based problem and therefore requires a movement-based solution. There's no one that can do the work for you. You can't lay down a table and just get adjustments or soft tissue or needling or these things and expect someone else to be able to take all the pain away for you. You have to have a movement rehab component to finally get the results that you need. So here is the 6-step mobility routine that you can begin doing to get away from the passive therapies and take active control of your body to get rid of this low back pain once and for all. The first exercise is actually a key staple in my lower body warm-up that I do before hitting legs at the gym, and it is called our oblique sit position. Now, for some of you, this will be achievable. For some of you, it'll be too advanced, and I'll discuss how to help all of you. But in this position, you're in a shin box position, some people will call it, like your Indian style with one leg back. You're gonna sit nice and tall, pick your hips up and forward, squeezing the glutes, slowly lowering to the ground, feeling your glute and adductor. An easy way to alternate is at the top. Swivel the legs to the other side, slowly lower, tap the glute, come back up, and repeat. This is a phenomenal movement for improving hip mobility and hip strength. You're getting internal and external rotation of both hips. You're strengthening your glutes, your adductors, spine positioning. You can brace while you're doing it too. This is a classic, and it is so good for your hips. Now, if you cannot sit tall while you're doing this, or it's difficult to come up, simply do this next to a chair or a couch. Hold on to it for support, and you can use that to assist yourself up and down. The next one is our thread the needle movement. On all fours, push the hips back as you lower your chest towards the ground. Reach down and through with one of your arms as to rotate your spine. You will likely get some cracks and pops throughout this movement. And what this one does is helps unlock your thoracic spine, your mid-back, if you will. And it's important to have good mobility through this region because if you don't move well through your mid-back, your low back has to work harder. Alternate both sides to improve the mobility going both directions, but having adequate movement through the thoracic spine, mainly rotation, is extremely important for overall spine health, especially if you're someone who's sitting locked forward in a position all day. Hey, real quick, I know you're struggling with pain and obviously want to fix it. So if you just text me the word pain to 317-751-9509, I will send you my free back pain fix demo. Just text that number and you can fix your pain. Thank me later. Back to the show. This next one is advanced, but it is phenomenal for opening up your hip flexor and your lower back. Get in a lunge position, lean forward and put the opposite hand on the ground. Now reach back and grab the foot of the rear leg, lunge into the hip flexor stretch while rotating your shoulder towards the ceiling. This is not only a hip flexor stretch, but you're increasing the stretch by bending the knee and stretching the quad. And then while rotating into this position, you're getting the low back involved too, further stretching away from that hip flexor to increase the stretch even further. Perform this on both sides. This is an advanced movement, and not all of you might be able to do this, but I want to show different movements for all levels. levels. So if you're able to work into this, or maybe you can't grab the foot yet and you just lunge and rotate, that's a simple regression too. But this is a fantastic, challenging movement for your hips and spine. Number 4 is our frog, cat, cow, where on all fours, spread the knees as wide as you possibly can. Sit back deep into the position as to open up your hips. And now with your full spine, perform a cat-cow motion. It's accomplishing two things at once. It's mobilizing your hips and mobilizing your spine, and also challenging your hips and spine control as you're keeping your hips in a challenged position while attempting to take your spine through movement together. This is challenging from a neurological standpoint, from a mobility standpoint, and it has multiple facets of benefit. If this is challenging, work on one, then the other. So just work on the cat-cow motion, work on slowly doing this with your hips wider and wider and wider, getting deeper into the stretch as you go so you can build up to this. Next one, get in a wide sumo stance position as to once again challenge your adductors and open up your hips. Now lean forward, hands on the ground like you're in a tabletop position. Then keeping one hand on the ground, remove one from the floor, rotate that towards the ceiling as far as you can as to rotate through your spine. Return it back to neutral and then switch to the opposite side. This is further opening your hips while rotating your spine, improving that joint and hip mobility together, but also requires some degree of muscular activation through this too. Attempt to rotate further and further each time as you allow the legs to stretch further and further apart as you improve this. The last one I call our pigeon rotation, where you get in a pigeon type pose, but we're not going to sit there and waste time. We're going to get active with it, where you're going to support yourself up off the ground, reach under your body, rotating as far as you can as to stretch and rotate your spine, as well as stretching your outer glute, your outer hip. And then you reach back as far as you can towards the ceiling. This is an active movement to work on your hip mobility, work on your spine, and you perform this on both sides, of course, attempting to reach further down and further up as you go. If you perform each of these for 30 seconds to a minute, it will not take you that much time, but it will make a drastic improvement in your mobility and pain. And movements like these have helped myself perform better and a lot of our clients throughout the world as well. However, there's one key piece missing to this routine that you likely need. So here's what it is. I've been making videos like these for years. I have thousands of videos, and we've helped thousands of people get pain-free who just watch our free content. But a lot of people, the majority in fact, will find that their situation isn't so cookie cutter. It's not the same as everybody else's. And although movement routines like these help people get started, these are not specific towards your situation. So what this one thing can provide, at least for a majority of our clients, they've seen an average of 37% reduction in their pain in the very first session. In some individuals, complete pain relief in as little as 15 days. And this one thing is called the centralization process, which helps determine exactly what's causing your pain and the exact movements you need to do to fix it with a specific targeted approach. So if you want to dive deeper with me and actually get a structured plan to healing, just text me the word pain to 317-751-9509, and you can get a tailored step-by-step plan to permanently fix your back or sciatica pain following our centralization process. Do it right now so you don't miss the opportunity to finally live the life that you deserve and get out of pain, because you only have one life and you deserve to live it freely. After you text me, please like the video, subscribe if you haven't already. Follow me on Instagram at RehabFix for more free daily videos and insights into my life on what I do to maintain a bulletproof low back. Thank you so much for watching. I'll see you on the next one, and I'll see some of you in our program real soon.